Yes, got it. Fine. So, welcome you all for our second part of this webinar on art of decoding pathological cases in homeopathy, right? So, in last session, we had discussed a very beautiful case of burn ulcer. You know, it was completely a misdiagnosed case by many doctors, and after detailed investigation, after detailed case checking, we got that it's not a burn ulcer. It was a it was not a varicose ulcer. It was completely a burn ulcer. On this entry point and on this typical uh, PQRS of pain character, we entered the case and we solved this case completely within only 3 months. Okay, he was carrying this pathology since last 6 years. Okay, but after giving medicine, only in 3 months he was completely better. So this is the beauty of how we are going to how we can use this art of decoding, the pathological cases. So how I learn on myself, how I develop my knowledge, how I, gone through many pathological cases, how I gone through many failures, many successful cases. And then after 15 years of my clinical practice today, and, since last few months, I'm sharing my knowledge with all of you. So there are so many stalwarts, so many legendary homeopaths in our homeopathic field, like Dr. Boger, like Dr. Pathak, Dr. Farrington, Dr. Lilienthal, Dr. Boninguson. They have did a superb work. So after going through all literatures, I have come to the conclusion of few decodings of few points on which I'm prescribing the remedy. Okay. So we will wait for more 3 minutes and then we'll come to start the session. Every homeopath must need to understand the only useful purpose of present birth is to turn within and realize the self. There is nothing else to do. This quote was given by Dr. Raman Maharshi. There is a huge meaning behind this sentence. The only purpose. So you must need to understand what is your purpose in this present birth. So as a homeopath, we are lucky to have this birth, and we are lucky to be a homeopath, because we are here to heal others. We are here to give peace to others. We are here to make free from sufferings to human beings. So this should be understand that you have to realize yourself that for what you have this birth, right? So in today's session we are going to 46 fine. So in today's session we are going to understand again a case of burn ulcer. Okay, then also in this case we will try to understand how artistically we understand the significance of diagnosis in dealing with this case. Along with that, how significantly we try to understand the clinical examination also in this case. What is the importance of observation in pathological cases? So in this case, I will show you how we can differentiate the ulcers, and what are the types of ulcers. Only on observation we can reach to the remedy. Okay. Along with that, in this case also, this is also case of burn ulcer. In this case, which approach we have followed? From which approach we entered the case? From which approach we took the totality? Okay. In last case, we have seen that how we entered the case, and when we come to the totality, we got a only single remedy, that is nothing but a causticum. And after that understanding of pathophysiology of causticum, we gave the remedy, and it was completely cured in some time, only in few months, right? So in today's session, which is new thing for you, which was not there in last webinar, is importance of state similimum in pathological cases. So today I am going to teach you these things. In last webinar I had told you four things, which was the etiology. The cause is important while dealing with the pathological cases, or also in the acute cases. Another important point is diagnosis. As we have seen that it was a case of venous ulcer, which was diagnosed by many doctors, but we came to the conclusion of diagnosis that it was a case of burn ulcer. The other important point is clinical examination. It's very, very important to go for every patient with the clinical examination. Then, and one of the most important point for everyone, even though from students from first year, second year, third year, final or interns, they can also enter the case from the modality. No doubt if you don't know diagnosis, no doubt if you don't know, how to do the clinical examination, but at least you can ask the modality, my dear friends. So from the modality, you will get more single and deeper peculiar, or we can say a peculiar symptom at local level. From that local level, you can also enter the case, right? So today we have a very beautiful case. In fact, I would like to tell you the case. Today I am going to tell you the story of irritable, angry, and violent granny. It's a story of a grandmother. She was suffering with the burn ulcer. Okay, so she is a granny of 53 years old, and she came to my clinic with this burn ulcer. You can see how this burn injury was there on, on the wrist joint. You can observe it. You can understand. It's completely burn ulcer. There was a blister formation. Now see the surrounding skin, how it comes black and it's removing out. Fine. It was right hand. You can see on the right hand there is a burn ulcer. So it's a very funny case. I will tell you how it was funny for me also, because we can't predict how patient will react with you, how they can talk to you, how they can react to you. It's very interesting. So this female patient of 50 years old came to me with burn ulcer. So her main chief complaint when she entered the clinic, she was completely telling that, doctor, I have severe burning pain in this ulcer. Do something for this. Constant pain, all the time, doctor. Especially this pain aggravates at night. I am not able to sleep since last 2 months. Whenever I used to go in open air, that time I felt better. So I asked her politely how it happens. Okay. But after asking this question, how it happened, she reacted so violently, so angrily. She became so irritable on me. She told me it's just because of vapor. It's just because of due to the steam. It's because of that. This was her gesture. This was her, reaction to me. So I told, okay, the granny is so angry on me. First of all, I thought that she could not understand me, how how I talk to her. But later on, I understand that it's something else. So again, I politely ask her, Granny, can you tell me something more about it? Then again, she replied, if is it possible for you to cure, then do it. Otherwise, don't ask me more questions. I just can't tolerate the pain. If is it possible for you to cure, do it. Otherwise, I am going from your clinic. Don't ask me more questions. Already I am suffering from this severe pain. If you are asking me more question, I will leave your clinic. This was her gesture. She was completely in anger. She was completely violent. She was carrying this constant pain since many, from 2 months. Again, I asked her, now see, I was on fire. She was like, she was like completely angry on me. I asked her politely, Granny, please tell me a little bit more about this problem, how it starts. Then she became little, she came into the mode of talking with me. Then she told me, I was making a chapati for my, I was making chapati for grandfather, means for her husband. She was making this chapati on chula. Chula means, we can say, Indian earthen stove. This case is from village level. So there was no gas, there was no, heater. So she was making chapati, means, on that Indian earthen stove. And due to the hot steam or due to the hot vapor of that chapati, there was a blister formation on her right hand. Okay, she was storing the journey of how it happens. She was like telling us how it starts. So first of all, there was a blister on her hand, and after that blister, it turns to the ulcer. Okay, so she belongs to a village level. Her husband is also farmer. She's also a farmer, and they are from very poor family. So there was always a quarrels at their home. But even though because of pain, she was narrating me with all these things in anger, in irritability. That was going on. So I said, okay, can you tell me something about the pain? Because she was constantly telling one thing only, I am suffering with pain. It was a constant pain. I thought, again, why not we can enter the case asking from the characteristic of pain, or asking by how to understand the peculiarities of the pain. Then she told me There is a severe burning pain, doctor, as if someone keep a fire on this ulcer, as if someone keep, the coals, the burning coals on my ulcer. Even though now I am also, experiencing that there is a fire on this ulcer, right? So what kind of a pain? As if fire, as if a coal on this ulcer. She was carrying this pain since last 2 months. Okay. Then her son told me that, doctor, since that she becomes so angry, since that she becomes so irritable due to pain, that in our home we are not there to talk with her. If we ask her something, she becomes so violent, she becomes so abusive on us that we can't do anything. So that's why in our family, no one has, no one have dared to talk to her. She don't want disturbance. She is completely in pain. But I noticed, doctor, one thing. In the middle of the night, at midnight, suddenly she woke up and she used to go on the backyard and she used to sleep there. When I asked her, Mama, please come to the home, come inside the home and sleep in the home. So she said, no, 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 I feel better here. In open air, this little pain, get better. But doctor, I would like to tell you one thing that was narrated by her son. Due to pain, there is a sleepless night for her. She is not able to sleep well. She is completely restless. She is completely in agony. She is completely, in pain. Do something, doctor. I said, okay. So in this case, at least we can understand the modality. We can understand from which, conditions is going on. That's why she became angry. She became irritable on me. Okay. So on clinical examination, I observed her ulcer. I tried to, go nearby her, and there was a severe offensive smell. There was severe putrid smell. Okay. And it was a dry ulcer. You can see also into the picture. It was completely dry. There is no discharge. There is no pus formation. You can see that there is just little bit debris or the little bit, little bit yellowish things you can see under in the ulcer. Okay. This is the complete story. Now, I'm going to tell you how the observation is very important in any pathological case. Whenever you are going to visit the ICU, whenever you are going to visit to the patient at home, you must need to observe each and everything. Okay, my dear friends, you always need to alert your all antennas. Nose, ear, eyes, smell. Keep it on observation. Okay, so in ulcer cases, what is important? The observation is important. What is important? To understand the smell, to understand the nature of ulcer. So now you can see the picture in first picture at above about the hand of ulcer. It's completely dry, but there is offensive smell. In second picture of thigh, it was a case of bone abscess. He had gone through the surgery, and after that there was no healing of that sinus. There was no healing of that bony, we can say, bony ulcer. There was a necrosis under the bone of thigh bone, and there was a constant pus formation. Now see, you can see that there is no bloody, there is no any kind of any other discharge. There is just a whitish cheesy discharge into the second picture, ulcer with the pus formation. And now see into the third picture, ulcer with the discharge from the diabetic foot. You can see there is a diabetic foot and the ulcer on the left side of a lower limb. And now see there is a bloody pussy discharge. So why I'm telling you these things, it's very important. Only on observation also you can enter the case. Only on observation you can get the PQRS. From this pus, the observation on this pus, on the color of pus formation, you can get the remedies. You can also get a hint of remedies how we can go through. We'll tell you. If you go to observation, now see there is a ulcer dry. We have 49 remedies. Okay, if ulcers dry and ulcer dry at the margin, you have sanguinaria, right? If ulcer dry, you have another remedy. Okay, so like this way we can enter the case. Another important point is here. We will come to the pus formation, the discharge. Now see, in this picture, there is an ulcer with bloody pus formation. But if there is a brownish pus formation, there is a bloody pus formation, there is a albuminous pus formation, there is a TG pus formation, there are different remedies, right? So like this way we can enter the case. These are the pathological routes where you can use only on observations, right? Now see, the ulcer discharge suppurating greenish discharge. So why this greenish discharge comes in any pathological case or any injury or any, we can say, ulcerative case? Anybody can type in chart why there is a greenish pus formation comes. Hello, you can type in the chat box why this greenish pus formation comes in ulcers or in injuries or in the boils. What is the hint we can understand from this point? Absolutely, you are telling a remedy. I am not asking the remedy, I am asking the infection. Okay, yes, absolutely right. It's because of infection, infected with Clostridium. Absolutely right. So it means that there is a necrosis and decaying of that tissues. There is a necrosis at the bony level, right? There are gram negative and gram positive bacteria, which is going to harm, which is going to create the infection at local level where there is ulcer or there is injury. So from this way we can understand the pathology. From this way we can understand the pathology and its prognosis, right? In last case, in the first webinar, we have seen that there is a case of unhealed ulcer, and I told you that into that ulcer of that person there was no smell. And now see in this chart, ulcer discharging suppurative odorless. There are only two remedies, calcarea carb and causticum. And previous webinar case was completely cured with the causticum. Now my question is that why only there is a odorless or there is no smell in discharge of ulcer, especially for calcarea carb and causticum? Okay, this is my question. You go and find out the question and you can send me the mail. This is question for you all. Why not the smell in calcarea carb and causticum? Okay, so now let's understand the next point, offensiveness. Ulcer discharge offensiveness in arsenic, asafoetida, bacteria, carboanimalis, carbovage, carbon sulf, chelidonium, okay, bromium. So what it means, we will get more offensiveness smells mostly in carbon group of remedies. Okay, another important point I would like to share with ulcer discharge suppurating. Now see the yellow brown, yellow green. These are the discharge I have seen in many cases of boils, many cases of ulcers, many cases of chronic injuries. Whenever you go and try to understand the case, whenever you go and try to see the case, always observe what is the color of discharge, what is the nature of that discharge, is there a smell or there is no smell. And from this point you can understand the remedies or group of remedies. Now if you have a pus formation by with yellowish green, you have only 8 remedies, and now you collect a totality. Maybe out of this 8 you can reach to the remedy. You can find out the exact similimum. This way also we can enter the case. So also from diagnosis we can also enter the case. So if ulcer is gangrenous, then we have 14 remedies. So always ask if there is a cases of ulcer or if there is a gangrenes, how it starts, what is the etiology for this. Okay, so in this case we have etiology of burn. It's not a gangrene, right? So we have solved the previous case with these 4 codes: etiology, cause, diagnosis, investigation, clinical examination, modality, that we have a peculiar, PQRS modality into the last webinar, in the last case of burn ulcer. So this is a question that for all of you, this was only short case. So where we can give more importance, where we can get the PQRS, where from which point we can enter the case. Okay, so we can enter from the diagnosis, we can enter from the etiology, or from the etiology, or from the location, or we can enter from the characteristic of pain. Means what kind of a burning pain is there. Okay, what is the associated symptom with the pain, what is the modality, what is your observation of that ulcer. So tell me from which point you can enter the case. Okay, so you must be need to interactive. Bacterial infection, modalities, Come on, type in a chat box. Yes, what is the amylation? Dr. Ruby, Dr. Kishan, you told about the modalities, but what is the modality? From what she get amylation? No? So it's very easy. It's not difficult. It's very easy. Yes, Nancy. Amylation by open air, absolutely right. Dr. Yamini, Dr. Dr. Ruby, Dr. Meenakshi, hot vapor, absolutely right. Dr. Meenakshi, the etiology of because of hot vapor. Okay, so have you know the rubric? Have you know that this rubric there is an ulcer because of hot vapor? Mental state. Dr. Manisha told mental state anger vent. Absolutely right. Burning like a hot. No, it's burning like a fire. Air relief. Rajashri Mantri said modality open air. Absolutely right, Dr. Meena Mantri. No, Kali Bai. I'm asking only rubric. Never jump on the remedy directly. Yet we are collecting a totality only, Dr. Meenakshi. We need to collect the totality first, no? Then we will go to the remedy, right? Yes, irritability pain during. Absolutely right. So, my dear friends, here I am going to show you the important points. Now, I am going to make you work easy. So, in this case, we have a diagnosis that is a ulcer burn. It's a burn ulcer which was failed to heal, and because of that boil, it turns to ulcer, and now it is not able to heal by any other doctors. Etiology is absolutely right because of hot vapor of that chapati. Location is on a wrist joint. On a wrist joint, it's very easy method. Okay. Characteristic of pain: pain burning as if like a fire, as if someone has put a fiery coal on my ulcer. This is the exact, we can say words by a patient. डॉक्टर साहब इतना जलता है जैसा लग रहा है कि अभी भी वहां पे आग है. डॉक्टर साहब ऐसा लग रहा है कि अभी भी वहां पे किसने कोयला डाला हुआ है, जलता कोयला मेरे हाथ पे रखा हुआ है, इतना जलन हो रहा है डॉक्टर साहब, समझ में नहीं आ रहा क्या आ रहा है कि मैं क्या करूं. Okay, what is the mental state in this case which was not there in previous previous webinar? She is completely in agony, she is completely angry, irritable, violent, abusive. She shouts, she's in rage. Don't talk me, don't disturb me, because of pain, then her nights are sleepless, she's not able to sleep, she's completely restless, she's moving from from inside the home and from inside out to the home, sometimes in backyard, sometimes in home, she's completely restless. Modality is very typical, emulsion by open air only. And observation, we can sense the smell which is very offensive, which is putrid. And most important observation is the dry ulcer. Okay, so now see, our things become so easy. We know the diagnosis, we know the etiology, we know the location, we know the PQRS of the pain, we understand the mental state, we know the her symptoms, the other symptoms, exact modality and observation. Right? So what to do now? How to go with this case? Tell me. Burns and scarred, yes. Tell me what are the rubrics which we can take, no? How to enter the case? So again, we can enter the case through like this. The burns failed to heal or ill effects. Now we have again 5 remedies. And arsenic, cantharis, carbo animalis, causticum, and nitric acid. One of the most important remedy. Yes, Dr. Neha Jain, burning as if like a coal fire. We need a remedy. In which remedy there is an exact sensation of a pain, exact burning pain, where the patient narrates that it's like a fire, it's like a fiery coal, as if someone put some coal on my fire. Right? Yes, we can think of arsenic album, but still we need to understand the totality. Right? Never jump on directly on the remedy. Is there location? Is there this anger? Is there this modality? Is this remedy is important for burn? That we need to understand. So I also did this mistake in my clinical practice. If I get a PQRS, I directly jump on the remedy. It can be a cantharis. This can be a case of acid group. It can be a case of nitric acid because of anger. Especially she has a fight with her with her husband. Anything can happen. Don't do like this. So take a totality first. So I always, told to my students and my colleagues, if you reach to the right remedy, don't feel that you are right. We must need to understand the process, the journey, the method, how we reach to the remedy. रेमेडी सही आना मतलब हमने फिर बहुत कुछ कर लिया, ऐसा नहीं होता है दोस्तों. वो रेमेडी गलत भी हो सकती है, सही भी हो सकती है, लेकिन वो रेमेडी तक हम कैसे पहुंचे, हाउ वी follow the steps, how we follow the process, this is important. Fine. So now we have these rubrics. See, we have skin burns fail to heal, our main rubric. Then etiology, we have take skin burns vapor from hot. There is also a etiology, burn ulcer because of cold, burn ulcer because of other chemical contents, chemical etiologies, chemical reasons. But here the skin burns vapor from hot. Skin pain, burning, smarting, fire as from. So now we got only one rubric, fire as from. Then what to do about the cold? Right? So this is very peculiar symptom because there are only five remedies. Right? Now see the location. Burn, skin ulcers, joint over. There is a ridge joint. This ulcer is on a joint. Pain, burning, smarting, air open amelioration. Exact modality. Skin ulcer dry. Exact observation. And what is the mental state? Anger pain about. Rage, fury pain from. Abusive pain from. Violent pain from. This is the exact, the totality we have. Then what to do? Which remedy we need to give? Come on, tell me. And why? Hello. Journey is important. Yes. Ulcer burn from complete. Yes. Acid nitric. Somebody said acid nitric. Okay. We can think of those people having a laptop. Start putting this rubric. I have make your work so easy. Now tell me the remedy. What is there in Siddheshwar Jadhav said it's a Merxol. हो सकता है. सिकेल का डॉक्टर नेहा जैन said हो सकता है, क्यों नहीं हो सकता? Absolutely right. Prajakta Mete said Cantharis. Absolutely. Because we have this remedy into causticum. Shikam said causticum. Dr. Naima ma'am said from Belgium causticum. Yes ma'am, we can think of causticum. Because it's already there in our PQRS symptoms or PQRS rubric. We can think of it. Anyone else? We have almost 82 participants. Apis, Samir Gupta said Apis mellifica. Yes, Dr. Samir sir, we can think of. Nanda said Cantharis. Okay. So now see the yes, Dr. Kalibai, Dr. Varsha, Kalibai, you are closer, Dr. Varsha. This remedy is in your periodic table. Okay, so now see what is the the dilemma, the confusion here. If you think of only a PQRS, directly our mind goes to the remedy, selection of remedy. Ye ho sakta hai, this can be remedy, that can be remedy, But now also in acute cases or also in pathological cases, we must need to give importance of totality. Take a totality. Under this totality, you must need to understand the etiology, modality, observation, mental state, characteristic pain, PQRS, diagnosis, right? So this is a learning. How I learn, in this 15 years, how I learn like this way. Also in a small case, I use repertory. I take a help of repertories and then I come to the final decision on materia medica. I take some I used to take references from different literatures, then I come to the remedy. Even this in repertorial chart, one of the most important PQRS symptom is miss tarantula. No, not tarantula, not Kalias, not meserium. Yes, meserium you can think of because of the location, because if you have an ulcer on a joint, you can think of meserium, but this remedy is not meserium. I will come to you. So what is important? Important is that you need to consider the totality. Though it's a small case, always think of modality. Always think of totality. Never directly jump on a remedy. This is a learning for me, and this learning I'm going to share with you, my dear friends. So always final decision goes to the materia medica. We can take a help of repertory. At least we can enter the case of through the repertory. We have a specific remedies, but Even though in this case, what is missing? The characteristic of pain. What is the typical picurious pain? As if someone has put a fiery coal on my hand. This is missing here. Okay, this is more peculiar. Who is going to tell you that डॉक्टर साहब ऐसा लग रहा है कि कोई इसने वहां पे कोयला रख दिया हो, इतना जलन हो रहा है, right? So we have to find out it. So here is your remedy. In this totality, we have arsenic. Also, we have cantharis. Okay, so into the repertorial chart, if we have arsenic, we need to find out all these things in the materia medica, right? This should be done by everyone, because we cannot rely on repertory. Repertory is a tool; it's not a final decision. So in materia medica, what Boger Saab told us, what Dr. Boger mentioned is materia medica under arsenic, maddening pain. See the maddening pain, the burning like a fire, as if a hot needles or a wire on my hand. Okay, and it's given emulsion by heat. So if you go to the repertory, you will get arsenic, the burning pain, emulsion by heat, and open air also. But what is important? The maddening pain, doctor. No one had, no one could dare to talk with her. Her son told, if you talk to her, she becomes so violent. She becomes so abusive. She shouts on her. She's like, she's like anything. Other important point, she's so restless. Because of what? Because of aggravation of affected part. Basically, her nature is not like this. Right? She becomes so restless, she becomes so angry because of that affected part, because of that ulcer. And what is the character of ulcer? Putrid, cadaveric odors, offensive smell, destructive process. No doubt, if this case could not, अगर ये केस हमारे पास नहीं आता था, then that case definitely goes up to the more deeper level of that bony part or that tendons. There can be a damage of radial nerve. There can be damage of ulnar nerve. There can be a necrosis at this, wrist joint. There are 8 bones. She looks too pretty. Try to catch her. I hope you learn these things in anatomy. Okay, so there are 8 joints. That ulcer can turn to the necrosis, and that can also turn to the gangrene, and that can create a big problem for her. There is a destructive process. Okay. What else? Allen साहब ने बोला है, Dr. Allen's keynote, it's given in under arsenic burning pain. The affected part burns like a fire. Okay, that affected part burns like a fire, as if the coal were applied to part. See the beauty of materia medica. How exactly given, as if the hot coals were applied to the part, and that was the exact line was told by the patient, as if somebody has put the fiery coal on my ulcer. Right? This is given in arsenic. What Bonington have told in his repertory, Dr. Bonington told there is a burning of skin, there is a carbuncle, there is a burn, there is a boils with the burn. And in this case, our case started with the boils, right? Our case started with the boils and then it turns to the ulcer. So it's important to consider each and every point in the case. Though it's a chronic case, though it's an acute case, though it's a pathological case, though it's an ICU case, though it's any case, but you have to consider each and every point. We cannot forget anything. We cannot forget the process. Process is important, my dear friend. Boil, then ulcer, then dry ulcer, then offensive ulcer, then the location of that ulcer, then the mental state of that patient with her disease or that local part or with the ulcer, how she react, how she talk to the doctor, how she behaves with us. Okay, see, it's very important. Definitely, it takes time for me to come to this point. For it takes 15 years. But whatever I learned from my clinical practice, that I'm sharing with you, my dear friends. So Farrington साहब ने क्या बोला है? What Farrington told us, this arsenic drug is similar to the malarial neuralgias, right? So this drug is also important for neuralgias. Then meserium, then magnesia phos, then calmia. You need to understand clinical materia medica. Mentals is important. Definitely mind is important. But whenever we are going to came across with the pathological case, always refer with the clinical mater medica, always refer with the clinical repertory. Now tell me the one question. I am going to ask you one question. It's a very basic and very simple question. You can, I know that all of you can give the answer for this. In arsenic album, why discharge is offensive? Why vomiting is offensive? Why stool is offensive? Why there is a putrid offensive smell in the, into the arsenic remedy? Tell me. Come on fast. Why is this so? Just not a single discharge of ulcer or injury. If you know the diary of arsenic, it's also offensive. Vomiting is also offensive. Nancy said destructive process on, you can think of. Victoria Perry said infection. Okay, Victoria, you are closer. Manisha Carter says necrosis. Yes, we can think of necrosis. Victoria Perry said infection. You are closer, Victoria. Just go more deeper to this. Vijaya Pratap Singh saying poison. Siddhesha said debris. Debris is a process. It's a vision. Poison. Poison of what, Dr. Vijay? Rama said courageousness. Courageousness is a nature of discharge. Courageousness is a nature of arsenic basically. But why it comes? The why is very important for every homeopath. Right? If we get a result, then why we have a result? Decompose process. Decompose process is absolutely right. Dr. Bikapurwala. Decompose process is right, but go more deeper to that. Putrefaction. Yes, putrefaction is there, but just go deeper to that. Yes, Dr. Nehajan. Now I am going to come to the answer. So here is the answer, my dear friends. So think like this way. Okay, why is important? See, like this way. So in arsenic, Dr. Borik told about this important line, tomine poisoning. So now tell me what is tomine poisoning? Anybody knows this word tomine poisoning? Don't Google, huh? Dr. Amit sir said destructive changes. Yes, sir. Syphilitic, think of decayed food, degenerative changes. Absolutely right. But what is happening in tomine poisoning? What is there? What it is given only in arsenic album? No. This tomine poisoning can lead you why there is putrid smell. Their decaying of food and animal matter will tell you why there is a chemical toxicity. It's a general word. Okay, we'll tell you gas. Yes, process. Yeah. So now I am going to tell you which is very, very important point of arsenic album. आपने बहुत बार पढ़ा होगा, but आपको ये पता नहीं होगा. That's I'm going to share you. Okay. So be alert and listen me carefully. This tomine poisoning is nothing but a process of decomposition, decaying of food or animal matter or the animal muscles. Whenever if you are going across the road and if you find you can smell that offensive or putrid smell across beside the road, that if their animal is decaying, and into that smell there is a tomine poisoning. So under tomine poisoning there is a chemical reaction. There is a formation of different acids. There is a discharge, acidic discharge, and into that acidic discharge there is a arsenious acid. Which acid? Arsenious acid. And this arsenious acid is nothing but a arsenic album. My dear friends, our arsenic album is no doubt it's a metal, but if you open the Clark or open any other clinical mater medica, it's also given in the bracket arsenious acid. So this arsenic album is also comes under acid group, right? So if you try to understand acid group of remedies, I'm telling you acid group of remedies, you will get all the discharge are putrid, all the discharge are offensive, all the discharge having a necrosis tendency, all the discharge having a destructive tendency. So while proving that time and in Hahnemann time, when they proved this arsenic medicine, that time they have used more part of arsenious acid. Right? Are you with me? I'm connecting with you. Are you with me? We are going to the source. I am telling you how to understand the mater medica. There always need to understand why is there. और हमेशा सोचोगे ऐसा क्यों है, इसमें रिजल्ट क्यों मिला हमको, वो अल्सर ड्राई क्यों है, why this is ulcer dry, why this is a putrid feeling, why there is offensiveness smell. And why arsenic helps us in this remedy? Why arsenic comes to the repertorial chart of totality? Why is very important for every homeopath? Go like this way. No doubt it's feel quite more heavy for the students, but my dear friends, you also need to think like this way. So almost all the acid group of remedy, you will get septic condition. It can be a carbolic acid, it can be a nitric acid, it can be a muriatic acid, it can be acetic acid. Here is the vast, a group of acid group. But always consider that arsenic album is also acid. No doubt it's also present in a periodic table. Okay. So that's why in tomaine poisoning, we have a, offensiveness. So that's why diarrhea of arsenic poisoning, diarrhea of arsenic patient, discharge of arsenic patient, this ulcer of arsenic patient, gangrene of arsenic patient having a offensive smell because of tomaine poisoning, because of that arsenious acid. Okay. So come to the our we have not too much time. We have to end the session in 1 hour. So this was the condition of our patient when she came to us. Okay. So after giving the arsenic album 200, she was completely better. She was completely cured. Just in a 5 weeks. So this is not a magic. This is a science. This is a evidence-based homeopathy, my dear friend. I would like to tell you one important point. I started my journey from ICU. I started from my my healing, my practice journey from my second year. I directly entered in ICU. I was working as a RMO-ship in ICU. Then I went to Mumbai. One of my mentor, late Dr. J.D. Samant sir, he told me, though you are a homeopath, but no one stop you to read MBBS books. No one stop you read to medicine books. No one stop you to read American Clinical Medica. American Clinical Medicines. There is no foundation. You can read any books. You can go to the under the pharmacology. You can read many pathological books. Okay, so don't limit yourself. Though you're a homeopath, think like that people also. Okay, so what we learned today? What is the next code to understand a pathological cases? So as I introduced you this 4 code: modality, etiology, diagnosis, clinical examinations, right? So though it's a pathological case, but if there is a current mental state is prominent, current mental state is PQRS, always consider it. Why it's important? From the current mental state, you can go to the posology. You can consider the level of patient. You can consider the potency. Okay, she never told me that, doctor, if my hand get gangrene, if my hand get cut ho jayega, to main kaise जीऊंगी. She is not in a state of delusion. She is not in a state of imagination. She just told me, if you can do it, do it. Otherwise, I'm going. I don't need you. Right? So always consider this. Current mental state is important. In any acute or pathological case, always consider this. Then there are so many other important points I would love to teach you. I would love to share with you. But one of the most important point is state similimum. Always think of state similimum. Always consider of state similimum. It can be etiology, it can be diagnosis, it can be a mental state, it can be PQRS, it can be factual things which is there in the case, it can be a modality. What in the state similimum जो आपके सामने है पहले वो देखो. In the case, what is in front of you, you have to consider this. Don't interrupt. Don't prejudice. Don't use your brain. Don't imagine. Right? So it means not that in pathological case you never consider the mentals. You can consider the mentals if it's prominent. You can consider the mentals if it's a PQRS. You can consider the mentals if it is related to your pathology or your affected parts. It's given restlessness because of aggression of affected parts. It's given by bone ulcer, right? And always think of the journey of the disease. So like this way, I understood the case. Like this way, from this dry ulcer, we result her with without any surgery, without spending much money, because they are from village level. They are not ready to go for more investigation. They are not ready to go for, for dressings and all that, because वहां पे है ही नहीं, वहां पे है ही नहीं हॉस्पिटल्स, या वहां पे है ही नहीं ऐसी चीजें कि जहां पे वो जाए और वो चीज करे. It's not possible for them. So somehow, if we have this totality, we can also give results to the patient, especially in a pathological disease, in a pathological or critical cases. So my dear friends, again, I'm coming to you next Sunday with the free webinar, to the next Sunday also with the free webinar. But on the day of Dr. Henneman, Master Henneman, on 10th of April, we are coming with the great mentors, the great clinicians, a superb group of doctors who are working in their clinics. They are dealing with the pathology, they are dealing with the clinical cases. Dr. Manish Jakpal is from Punjab, Ludhiana. Myself also there with you in all the sessions. I'm also going to share you my small cases. In my full session, I'm going to share you how to understand the cases in ICU, how to understand the comatose cases, how to understand semi-comatose cases, how to understand the cancerous cases, how to approach these critical cases. Dr. Manish Yadav is one of the renowned homeopath from Mumbai. He has experience with working with Dr. Sarkar, Dr. Chatterjee sir. He has a huge experience of dealing with cancerous cases. Dr. Ranjan Bensare is from Varud. He's one of the gold medalist person from NAHI, from National Institute of Calcutta. He's also doing fantastic work in his clinics. He's seeing 80 to 90 patients per day. All are pathological prescriptions, all are clinical prescriptions. Then Dr. Abhishek Joshi is one of the renowned homeopathy in Mumbai from Ghatkopar. He's associated with Dr. Farooq Master. So I am trying to learn, I am trying to, make you all in the loop to learn different mentors, right? Though your remedy can be right, but the process is different. So it means not that your remedy is right means you have done a fantastic work. You have won a medal in webinars, not like this, my dear friend. What is important, if you could get this patient, then how you reach to the approach, how you have a thought, how you could go with the cases. This is important, right? So for this webinar, this will be on 5 Sundays from 10th of April to 8th of May. We are taking 1.5 hour of session for each session, and we are coming with a very few, very low kind of a fees, just 200 per session. So those who wanted to join this session, they can enroll, they can register as early as possible. And here we have a team, Dr. Neha, Dr. Annabelle, she's from Canada. We have a clinic over there, Dr. Aarti Motwani, Dr. Mukesh Jaiswal. This is a completely teamwork. One of our backbone is Dr. Valeria Mendoza from Goa. We have a huge team. We all are working with you. Okay, we all are taking efforts to give you our cases. I'm trying to share you my knowledge. I'm trying to share you, how I grown up, how I did my hard work, how I learned all these things on my own. Okay, so this is all about. So I would like to tell you, you must join this webinar. I would like to insist you, right? Why insist you? Because you can learn many things from different mentors. And ultimately, we are working on a pathological cases. You will learn the different approaches, right? So this is all about for today, right? And this is a learning. This is a different code. This is also a learning that you learn today, a state similimum, right? Yes, Dr. Mahesh, you can ask the question. Dr. Mahesh has raised the hand. You can chat. You can send me a question in chat box. Those people who want to ask a question, you can send me in chat box. Dr. Varsha Khurana from Delhi, can you conclude the session? Can you end the session with your learnings, your experience of today's webinar? IT, can you unmute them? Yeah, fact meaning is nothing but what is the factual findings in front of you. What is there in the case? You have to consider it. If the ulcer is on a joint, consider it. If ulcer is dry, consider it. If ulcer is offensive, consider it. That is the factual things. Yes, it's in repetition. Arsenic album 200, BD for 7 days only. After that, we have stopped the dose because her pain was completely reduced. Yes, IT, can we unmute Dr. Khurana? Dr. Varsha, are you there? Fine.
I think Dr. Varsha is not there.
Okay, then who can conclude this session? We are going to search. Okay, fine. Yes, we can unmute Dr. Victoria Paris. Dr. Victoria, I hope you can conclude this session. You can share your experience with us. What you learned from this session. Can we unmute her? IT?
Dr. Victoria, please unmute yourself.
Dr. Victoria, you can unmute yourself. Fine. Yes, Dr. Aarti.
Yes, Dr. Pravin.
Yes, tell me.
Summary for the today's session was, if we compare today's session with the last session, the learning was never take the diagnosis of the other doctor. Always take your own diagnosis with proper clinical examination, taking what is there in the case and keeping that thread. Today in your case, the state of the patient, which was so prominent in the symptom, in the ulcer, taking that in the totality, and after getting the remedy in the repertory, rechecking it in the Matra Medica and being sure from all the sides was a learning lessons in this today's session.
Okay, thank you. Dr. Anna, can you share your experience with this webinar? Please unmute Dr. Anna from England. Thank you so much for joining our webinar. Please unmute yourself and share your experience from London. Anna, are you there? Am I audible, Anna? Okay, fine. So friends, this is for today's webinar, and hopefully we are meeting again on next Sunday, again with the free webinar on art of decoding in pathological cases, right? So stay tuned with us, and yeah, so stay tuned with us. You can connect with us on our mail ID, Toshi Homeopathy, toshi.homeopathy@gmail.com. You can also connect with us on this number 9011402676. You can pay us and you can join this webinar as early as possible, because it's only for limited seats, because we want to interact with each and every students. We want to interact with each and every participants. So thank you so much for joining us. Bye bye and take care.